Hey everyone, it's Lisa here with Hope for SCD in honor of World Sickle Cell Day, June 19th, which is coming up really quickly. We are doing 30 days of videos about clinical education and clinical trials, and so it's kind of exciting to see all the different ways that people can get involved. And today we're going to be talking about a clinical trial based out of Tennessee at St. Jude's Children's Hospital. And this study is, they're trying to build a database, so it's basically monitoring and tracking children and young adults all the way through the transition period up to age 25. So any child, boy or girl, or young adult, between the ages of newborn and 24.9, so that's like the month before you turn 25, you're still eligible if you're that young, can participate, and it's all types of sickle cell, and there weren't any specific exclusions. So their objective is long-term tracking of people living with sickle cell, specifically making sure that they can track through that 18 to 25-year-old period to detect when organ dysfunction is starting. Other things that they were also looking at was, they know that hydroxyurea helps in lots of ways. They don't understand its effect on organ dysfunction, and does it prolong when that will start, or does it just completely eliminate organ dysfunction in young adults? Because what research shows is that long-term organ damage leading to some of your organs not working quite right, like your lungs not having that capacity, or your kidneys not working as well, or your liver, really starts to show up in your care during that 18 to 25 period. So they're trying to start tracking kids from at a way younger age all the way up, so that they can start to see some trends. And it's a really long study that they want to, if somebody started at newborn, they would in essence be tracking you for 25 years if you were open to that. They do have a period where you can say, I'm just kind of done being tracked, and that's okay, but they want to collect as much data during this 25-year period, and then they're going to go back and look at, when did the organ dysfunction start? How did it progress? Is it more common in different types of sickle cell disease? Are there certain risk factors that make you at a higher risk for having more serious complications? It's a really simple study for you as the participant, in that all they're asking to do is take out a little bit more blood than they normally would at your annual visits. And the time frame they're looking at is when a child is 6, 12, 18, and 24. And then they just follow up telephone-wise after that to kind of see how your health has been until you don't want to participate in the study anymore. Contact is Dr. Jane Hankins, 866-278-5833. And St. Jude's is both the sponsor, and they don't have a collaborator. So if you're unfamiliar with how St. Jude's works, all the people receiving care there get so at no cost, but they're also in at least one of their research studies. So a lot of people that have more of a severe type of illness, or they have a cancer that's undiagnosed, or things of that nature, wind up at St. Jude. So you can come from all around the country, and I've spoken with them personally when we moved to Tennessee about getting involved, and they were really open to that. You just have to qualify for a study, which this one's really simple to qualify, because you just have to be between the ages of 0 and 24.9 and have sickle cell. So that's anybody in our world that's under the age of 25. So that was exciting. Check it out and stay tuned tomorrow when we come back again. Thanks. Bye.